Hey guys, welcome back. I'm Jess the MD. Thank you so much for joining me. Today we are watching a highly requested episode of House. We are watching season 1, episode 21, 3 stories. Let's jump right in.
He is not sick.
Dr. Riley is throwing up. He obviously can't lecture.
You witnessed the spew, or did you just have his word for it? I think I'm coming down with a little bit of the clap. May have to go home for a few days.
Dr. Riley doesn't have a history of lying to me.
You said this is the 5th time he's missed a class this year. Either he's dying or he's lying.
I'll give you 2 hours off clinic duty.
Fine, I'll have Cameron do it. She loves inspiring the inspired.
You'll do it.
Why is it always me?
Because the world hates you. Or because it's a class on diagnostics. Pick whichever reason feeds your narcissism better.
There are, in fact, some doctors, not me, who don't like speaking in public. So it's totally understandable that House doesn't actually want to give a lecture. Now, from what I know of House, he doesn't actually want to be in clinic either. So lesser of two evils for him seems to be lecturing. He actually is an incredible diagnostician. So he really is the perfect person to give a lecture on diagnostics. Just saying.
3 guys walk into a clinic. Their legs hurt. What's wrong with them? I'm not gonna like you, am I?
The most likely cause of leg pain is muscle strain. Apply heat in rest affected areas.
Statistically, you're right. Very good. My experience, over half of leg pain is musculoskeletal, generally from excessive exercise. 12% is varicose veins brought on by pregnancy, and most of the rest is the result of vehicular accidents. I said 3 people. That's 6 legs. So you've got 3 hurt jogging, 2 in collisions, and 1 of the legs is pregnant.
Just one little interjection here. Varicose veins are not always brought on by pregnancy. There are a lot of men that also experience varicose veins, so that's not entirely accurate. I've had plenty of male patients who have never been pregnant, who have varicose veins that cause pain and require treatment.
Did you hike to the fence, and how far?
Yes, it's about a half a mile from my farmhouse.
And where is the pain localized?
It started just above my ankle and it's radiating up.
So, what should we do first?
Family history?
Indicative of leg pain, that's a very short list. Any history of bone cancer, osteogenesis imperfecta, or multiple myeloma?
Could be a blood issue. We should run a CBC and a D-dimer.
And get an MRI.
MRI or a PET scan?
If the problem's vascular, he's better off.
Sorry, thanks for playing. Patient's dead. You killed him.
We had no time to run any tests. There was nothing we could do.
You had time to look at the leg.
Does he have a blood clot? It's probably less likely since he's a farmer, he walks around a lot, he's pretty active. There's so many different things that can cause leg pain. Muscle strain, definitely one of those things. Is there an infection of some sort going on? Is he septic and about to die? I don't know. This is House, and it could literally be anything.
Puncture.
Snake bite.
That would be my guess.
Farmer didn't know he'd been bitten by a snake.
That's what he said. Sudden shooting pain, tall grass, never saw a thing.
Is it a snake bite or is it a puncture wound from something else? Falling on a rusty nail? So many things that could be out there that harbor Clostridium tetani, or the thing that causes tetanus. And if this guy hasn't really been receiving medical care like primary preventive medicine, he may not be up to date on his tetanus shot. He may be decades overdue. And in that case, he could definitely die from something like tetanus.
You got all this from an examination to me?
I think she's depressed.
She doesn't have tendonitis.
She has tendonitis.
She's depressed about having tendonitis.
She's depressed for the same reason that she has tendonitis.
Not the boy.
No, the boy's a jerk. She knows that, and yet she's depressed. I found a nodule.
Problems with the thyroid gland causes depressed mental state, can cause inflammation of the tendons.
I'll run the tests.
Having a thyroid nodule is not really what indicates whether someone has hypothyroidism, which is the thing that is strongly associated with depression. So while this connection sort of makes sense, it doesn't entirely make sense.
What do I do?
We can't diagnose him while he screams.
Better than killing him with painkillers. That.
Apparently, he's not allergic.
Thank you. I feel a lot better now.
We screwed up.
No, you did exactly what his attending did.
And that was the proper way to handle the case?
Yeah,
The guy used him as a dealer.
you're going to see a lot of drug-seeking behavior in your practice, and there's a reason it works.
This is a very tough position for doctors to be in. It happens, I think, most often in the emergency room, but almost as often in the primary care setting. We're trying to balance treating real pain and making sure that we're treating people appropriately, not under-treating pain in any way, but also not putting people in harm's way and giving them medications that they A, do not actually need, or B, medications that can be harmful for them. As doctors, our goal is to help our patients, keep them safe, keep them out of harm's way, keep them pain-free and healthy.
Snakebite guy's way more interesting. Gross, actually.
The patient responded to epinephrine and the allergic reaction was arrested. Unfortunately, the patient continues to deteriorate.
Maybe the snake wrangler was wrong about the type we caught.
The FACSIS venom test confirmed it's a timber rattlesnake.
No, it's not. Notice the volume?
I skimmed over that, and the gender and the coloring jumped right to the name of the snake.
200 milligrams. Our guy got bit less than 4 hours ago. There's no way a snake regenerates that much venom that quickly.
Wow, that's really interesting, and also something that I would definitely have to look up because I would not know that in a million years off the top of my head. That would just not be a thing I'd know. Volleyball girl does have hypothyroidism, it looks like. They didn't mention anything about her TSH, but if her free T4 was low, then presumably her TSH, the thyroid stimulating hormone, was elevated, and so they're giving her thyroid hormone. There are other symptoms of hypothyroidism, things like feeling really cold all the time, feeling super fatigued, having difficulty with weight loss, or having weight gain. There are so many other things that it can cause, and that's something that I look for on labs when someone's coming in telling me that they're having difficulty with their mood. We're looking at things like TSH, like vitamin D, because there are things that can be physiologically wrong that can also cause a mood disorder.
We gave the guy the antivenom.
What if I'm allergic again?
That's why these people are here. If you have a reaction, we're ready to do whatever's necessary to ensure your airways stay open and your heart keeps beating.
My wife's on her way in. Can't this wait?
I'm sorry. Can't.
If he really wants his wife there, at least have the conversation like, hey, you're getting a lot worse really quickly. We really need to be doing this now so that you can hopefully see your wife when she gets here, because we don't want you to die in the next 20 to 30 minutes.
His condition's not improving. Double the dosage.
Already did.
There's another antivenom. It's not as effective, but
Already tried it.
the first stuff he was allergic to.
Gave it to him with high-dose steroids. Nothing's working.
What does it all mean?
Wrong snake.
We tried every other antivenom we had.
We're too late.
Yep. He's dying. His wife's here. Finally found a babysitter. Who wants to let him know? Actually, I'm kidding.
He's not dying?
Oh yeah, he's dying. There's no wife and kid. Which is great. Makes the breaking the news thing way easier.
No, it doesn't. It does not make breaking the news easier. It is never easy to break that news. Just no. The problem is that people that come into the hospital, unfortunately, we can't always fix it. Sometimes people are too far gone, things are too far progressed for us to be able to do anything about it. And it is so hard on everyone involved, including the person if they are conscious. This is awful.
Yeah, one more piece of news. The drug addict is peeing blood.
Does the drug addict actually have a kidney stone? That could be causing some severe pain, particularly in the back. And also, someone might be grossly urinating blood.
This buddy of mine, I gotta give him $10 every time someone says thank you. Imagine that. This guy is so good. People thank him for telling them they're dying. And it's brown. I don't get thanked that often. You're dying. In a few hours.
I'm sorry, I'm not laughing at the fact that this patient is dying. I'm laughing at the fact that House thinks that that is an appropriate way to tell someone that they are dying. Again, I'm gonna get slack for this in the comments because House is House and we know this is how he is, but in general, in the real world, no, you don't say it like that.
You're not going home.
My dog. What will happen to my dog?
Her neck looks clean. No adenoma.
Wait. The guy's dying and all he cares about is his dog?
Any of you guys go the dog route in your improv sessions? It's a basic truth of the human condition that everybody lies. The only variable is about what. The great thing about telling someone they're dying is that it tends to focus their priorities.
Did this guy's dog bite him and now he has like necrotizing fasciitis or something? He needs to be on IV antibiotics, have surgical debridement immediately, and even that, yes, people die quickly with neck fash.
What'd you call that?
A viral
It's
particle?
tea-colored, right?
The guy we thought was just after the drugs. What's the differential diagnosis for urine that's tea-colored?
Kidney stone.
He could have rhabdomyolysis, so breakdown of all of his muscles for whatever reason. Maybe he just ran a marathon, who knows? Lots of reasons.
Blood tests show elevated creatine kinase. What does that tell you?
The trauma diagnosis is right. He takes it easy for a
Rhabdo.
few days, he'll be fine.
You sure?
The elevated CK rules out infection.
You know what's worse than useless? Useless and oblivious. What are they missing?
You know, it's kind of hard to think when you're in our face like that.
Yeah? You think it's gonna be easier when you got a real patient really dying? What are you missing?
Muscle death.
So it sounds like the guy does have rhabdomyolysis. Why he's having muscle breakdown, that is next on the list to figure out.
Dogs' mouths are pretty filthy, but they have natural antibodies to fight off most of the stuff. We don't. That's why dog bites can be so nasty. The lab test of your dog's saliva revealed the type of strep bacteria. It's commonly known as the flesh-eating disease. We'll need to operate immediately to remove the damaged tissue. We may need to remove the leg.
Are all three of these patients gonna end up amputees? That took a turn in a direction I was not expecting.
The MRI revealed a problem.
No kidding.
I'm sorry none of your doctors found it earlier. I am personally going to oversee your treatment from now
You're
on.
gonna cut me open, aren't you?
We may need to remove the leg.
What problem did the MRI find? Like now I'm very curious.
His MRI showed that the leg pain wasn't caused by the self-injection. Wasn't caused by an infection. It was an aneurysm that clotted, leading to an infarction.
God, you were right. It's House.
We have to do the surgery. The necrotic tissue has to be removed. If there's too much,
I don't care what you find.
it may become necessary in order to save your life.
I like my leg.
Okay, that makes sense. This is how they were telling House's story and what happened to him and why he walks with a cane and a limp. I understand wanting to keep your leg because it feels like it's obviously a huge part of you. Considering the alternative is necrosis, bacteremia, so meaning bacteria getting into the bloodstream, and then death. I think there are definitely some people that would choose death over amputation. But we also know that House has gone on to live a pretty happy life, despite the fact that he has a disability. And if he were to have had an amputation, he would have learned how to function with that too. And he presumably might need less painkillers because I know that his leg definitely still hurts him.
Do a bypass, restore the circulation.
Amputation is safer.
For you or me.
The blockage of blood flow.
4-day blockage.
Yes. It caused muscle cell death. When those cells die, they release cytokines and potassium.
If you restore the blood flow, instead of just lopping it all off, then all that crap gets washed back into my system. The cytokines could cause organ failure, and the potassium could cause cardiac arrest. On the other hand, I may just get the use of my leg back.
The post-operative pain alone.
I'll get through it. I understand the risks. You're in the clear. Go schedule an OR.
He should be speaking with the surgeon about this because Cuddy is not going to be the one that's actually performing the procedure. He needs to talk to the surgeon and make sure the surgeon is comfortable with doing this. I totally understand what he's saying in terms of wanting less risk and doing the less risky operation, but I also guarantee you the surgeon would like for him to keep his leg, and if he can, he will do that.
It's not getting any better. If you were right, the pain would be subsiding. You'd be getting better.
It's just taking longer.
No, it's not. We've got to let him cut the leg off.
It's my leg.
Man, I have had to have this conversation with patients before, and it is a very, very difficult conversation to have, a very difficult choice to make. We've had patients that have had frostbite and they are likely to die from the bacteremia and from becoming septic from their necrotic feet. We've had patients who have diabetic foot ulcers that are not getting better, and they can also pass away from that. The reason to do an amputation is to save someone from a pretty terrible death. In House's case, there is some sort of middle ground. Are they cutting away some of the necrotic tissue? I don't know. Let's see.
He is asked to be put in a chemically induced coma so that he can sleep through the worst part of the pain.
We can do that.
What happens after he's in the coma?
We'll obviously monitor his condition closely, and if he can get through the next 48 hours without another cardiac incident.
I meant I'm his healthcare proxy. I get to make medical decisions for him if he's not able to.
You should talk to him about what he wants.
I know what
to
he
do.
wants. But if he's out, it's my call, right?
I don't think that's quite right because they are actually sedating him. You can't sedate someone and then make decisions for him unless the status has dramatically changed, unless he's becoming hyperkalemic over and over again to the point where we are having to code him and we have to do all these things to save him. But just knocking him out and then being like, okay, we're gonna do this, that's not how that works.
The middle ground you were talking about?
We go in, take out the dead muscle. There's still some risk of reperfusion injury, but...
Give me the forms you need signed.
You're saving his life.
So they are going to debride the necrotic muscle. Great, that seems like a decent solution in this case. But again, you are doing it without the patient's consent, and he voluntarily asked to be sedated. There's some legal issue here, and the medical power of attorney does not get to make this decision because you can also easily reverse the sedative, wake him up and talk to him, and he's fairly clear-headed. Yes, he's experiencing a lot of pain, but he's still relatively clear-headed.
She had no right to do that.
She had the proxy.
She knew he didn't want the surgery.
She saved his life.
Well, we don't know that. Maybe he would have been fine.
It doesn't matter. It's the patient's call.
The patient's an idiot.
They usually are. You have a buzzer or something? What time's this class end?
20 minutes ago.
I'm not doing this again. And this guy is not the world's greatest dad, not even ranked.
Who the hell lets their kids play with lead-based paint? That's why he's always sick.
Find him some plastic cups and the class is all his again.
I love that House has just passively made this other diagnosis because he's just excellent at what he does. That was a crazy episode and so many different things on the differential. That was a really cool lecture. I actually would have loved to be sitting in listening to this lecture because that was quite engaging and very, very interesting. If you guys enjoyed this episode, please leave a like, comment down below, subscribe to the channel. It really helps the girl out. Thank you so much for joining me. I'm Jess the MD. I really enjoyed spending time with you. I hope you enjoyed spending time with me, and I will see you in the very next one. Bye.